I'm pleased as chair of BudgetSub3 to convene the first Sub-3 hearing for the year, and I'd like to welcome everyone on your participation. Thank you for joining us, Senator Stone. It's a pleasure once again, sir, to serve with you. For people watching outside the Capitol, we want you to know that we value your input as part of this democratic process. For anyone interested, budget staff can provide you with our set of hearing schedules so you can plan ahead and participate as you see fit. We encourage input from the public because it's really through your input and public testimony that we can fully assess the needs of the state of California. Once again, it's an honor for me to chair this budget subcommittee. The subcommittee is responsible for overseeing the funding for many critical programs that we care about, like CalWorks, in-home supportive services, developmental disabilities, CalFresh, Medi-Cal, Denti-Cal, child welfare services, SSI, SSP, and senior programs through the Department of Aging. These programs, from my perspective, are critical to the state of California. For example, CalWorks currently has a caseload of about 500,000. CalFresh, nearly 2 million cases. 45,000 children are currently serving in California's foster care system. Regional centers serve over 300,000 Californians, 489,000 cases in IHSS, and 1/3 of the state's population are Medi-Cal beneficiaries. So together, the proposed budget funding for Health and Human Services is $136 billion, with a B dollars, $34 billion of which are general fund expenditures. That's about 27% of the total general fund expenditure in our state. And while this amount sounds like a lot, there's also much need throughout our Health and Human Services programs for additional investments to prevent people from falling off the proverbial cliff, to ensure survival for some and give opportunities and foundations for people to thrive and actualize their power and capacity. As California continues to recover from the recession, the data shows that the recovery is uneven, with some groups getting richer and others continuing to languish in poverty. The housing market is challenged at best, with low-income families in urban areas are really continuing to feel the pinch. Far too many people, families, children in foster care, are living on the streets in all of our communities across the state, facing the elements. This budget process is our way of figuring out what we must do, how we must prioritize our state's funding to make sure that all Californians have access to the resources and services that they are entitled to. We'll examine many critical questions during this budget process, and we look forward to engaging you throughout the process. Today, we'll begin by discussing the Office of Health Information Integrity, Office of Patient Advocate, Office of System Integration, and the Department of Public Health. We won't be taking any actions today. The items will be left open for additional input as the budget season continues to unfold. Sir, do you have any opening remarks you'd like to make? Senator Stone.
Thank you, Madam Chair. Good morning, ladies and gentlemen. Madam Chair, it's an honor to serve with you on this subcommittee again, and I appreciate your ongoing passion for helping people less fortunate than ourselves, which is one of the things that I love about this committee, is that we're addressing a lot of issues that plague us throughout the state of California, including homelessness, and providing social services for many people that's still, in the midst of them saying the recession is over, are still needing a lot of help. I'm also going to be looking, as we have these informational hearings, to make sure that we are doing everything we possibly can in a cost-efficient way to make sure that we don't waste money, that we use very critical and scarce resources to help expand programs to help people that are in need, where you have basically a third of the state of California now in the Medi-Cal program. 1 in 4 families are living in poverty, 1 in 4 kids. And so our job is not done. We have a lot of work yet to do here in the state, and I look forward to coming up with some great solutions and capitalizing on the significant amount of money that you heard that we spend to taking care of those people that need our assistance. But there's only a finite amount of money, so we have to look diligently at cost efficiencies. We have to not look at perpetual handouts, but we got to look at new ways to hand ups and help elevate people out of poverty and help them get vocational training and help them become a part of the workforce, and making sure that the training that's being offered in our high schools and our community colleges and our universities are commensurate with the job markets in their particular respective areas, because we have kids that are graduating from college that frankly can't find jobs. And so we need to retool and have better communication with our educational institutions, and I look forward to doing that. And I also have quite a legislative agenda this year that is really geared towards the working and middle-class people of California to try to make their lives better and more productive. So I look forward to the presentations, and thank you for the opportunity to speak.
Thank you very much. We look forward to partnering, Senator Stone. Generally, throughout the course of our sub-3 hearings, the process will be we'll have administration, representatives from the administration, LAO Finance, present public testimony, and if the committee is going to take action, we'll take a vote. Today we'll have public comment after each panel. So with that, let me begin. Item 0530, California Office of Health Information Integrity. Ask the panel to step forward, and we're going to begin on page 3 of today's agenda. We'll ask LAO and Finance to also come forward. Welcome back, everyone. I'll be seeing you all regularly throughout the course of sub-3, so it's good to see you again. Thank you. Good morning.
Good morning, Madam Chair and members. I am Jennifer Schwartz. I'm the Chief Counsel of the Office of Health Information Integrity, Cal Ojai, and I'm here to discuss our restructuring proposal this morning. The agenda did an excellent job of outlining the issues, and it appears that the first question is really asking for an overview. I'd be happy to dive in if that's acceptable to you.
Please.
Okay, thank you. Cal Ojai was established in 2001 as a result of some sweeping federal legislation called the Health Insurance Portability and Accountability Act, commonly known as HIPAA. California already had existing state law protections on health information, but this federal law essentially created nationwide new requirements for privacy, security, and patient rights on a nationwide and affected both the private sector and the public sector. Cal Ojai was established to facilitate, coordinate, develop, and directly assist with the implementation efforts on a statewide level. Cal Ojai's jurisdiction includes state departments under the executive branch of government, which are impacted by HIPAA. At the original founding of the office, Cal Ojai's responsibilities included interpreting how the federal requirements, these new requirements, impacted existing state requirements, evaluating the impact of these federal requirements on the business processes of state departments, for example, assessing the impact to IT systems, whether or not there was a need for modification to or additional security technology, and of course, assessing what kind of artifacts were necessary for an appropriate compliance program. Additional responsibilities include directly assisting in development and project management of the development of the infrastructure in state departments and the compliance programs within state departments, facilitating and coordinating compliance efforts between the private sector and the public sector, and monitoring and reporting on the progress of implementation. Since the full implementation of the federal legislation has occurred, Cal Ojai has shifted its focus, and therefore we have changed some of our responsibilities as a result. At this time, Cal Ojai's responsibilities include assessing the level of compliance in state departments with federal and state requirements. We do this through a tool, the compliance review. The reporting on the deficiencies of state departments with compliance for state and federal requirements. We provide assistance and technical assistance with the creation of, and of course we ensure appropriate corrective action. and we update our existing policies and compliance tools. The change in responsibilities is a direct result of achieving our mission's goal, which was the full implementation of that federal legislation, thanks to the hard work and excellence of Cal OHI employees and staff. As state departments established their own infrastructure and evolved their compliance programs, naturally Cal OHI's focus evolved also from the implementation towards compliance and just monitoring and oversight of those compliance activities. As, for example, the things that are no longer necessary that we achieved before, and of course there's a reduced need for things such as assessing how state law requirements are impacted by the federal requirements, assessment of IT technology impact, coordination between the public and private sector, and there is of course less need for direct technical assistance and the usual assistance we would provide at the implementation stage for state departments with regard to interpreting that law, because state departments have experience with this law, and of course we have recently published our statewide health information policy manual, which clearly outlines state and federal requirements. That is a mandatory policy. There's also less need for training and education because state departments have their own compliance programs at this time. Cal OHI recently streamlined our compliance processes and our compliance tools by developing, piloting, and implementing new compliance measures that will require reduced staff and resources to both use and maintain. Cal OHI engaged in a zero-based budget analysis to re-baseline staffing consistent with our reduced responsibilities. We had not balanced that staffing or re-baselined since the establishment of our office in 2001. The staffing levels in the proposal are appropriate to effectively achieve the new goals and the reduced responsibilities. Although staffing will be reduced, the current compliance activities we perform will continue. As part of our streamlining and creating a checks and balances process, of course, state departments are required to monitor and report to Cal OHI serious risks to the state, such as security incidents and breaches. Cal OHI acts very quickly to address serious risks, as well as working very closely with these state departments to ensure that they perform adequate corrective action. Do you have any other questions for me?
Thank you. Appreciate your presentation and appreciate the budget reductions. It's very refreshing to see that
It can be done.
It can be done, and I imagine that you're utilizing technology and you're getting to a certain plateau where you're meeting federal standards, which I understand are going to be probably changing every single year. So you look at all IT systems that are related to health throughout the state of California and ensure that they're in compliance with HIPAA.
So I would like to make a distinction. When HIPAA was first established, there was a real question as to what kind of IT system needs or what kind of impact there would be. At this time, there is another state department, the Office of Technology, that really engages in doing the review of IT systems and security measures. We have much less of a role in that. Our goal is to look at a very high level of certain very important high-risk categories for security measures and look to see, are those being done thoroughly and adequately? But we're not deep diving into looking or assessing any impact to any IT systems.
So if there was any breach in any of our healthcare systems that would be taking us out of compliance with HIPAA, they would report to you.
Absolutely.
And then you would obviously coordinate with IT and said, we got to fix this breach.
Absolutely.
And we've seen certainly in the private sector unbelievable breaches, which are hard to fathom when you have encryption and things like that. How have we been doing as a state as far as hackers? I mean, are we pretty well protected thus far, or has there been some alarming signs that require IT intervention?
So I think there's been less of a risk to the state than to the private sector. There's a lot more money involved in that kind of activity in the private sector than with the state. That being said, I think that the things that we've seen thus far are not to the extent that we've seen in the private sector. I could happily provide you with additional information later. I don't have necessarily any statistics on the top of my head that I could provide.
I haven't certainly heard of anything that's, it sounds like everybody's doing a great job as far as protecting this important medical information. What about with regard to, I know we communicate regularly with counties that have to deal with a lot of health issues that the state has databases that they can legally intertwine with. Are we finding that that is a user-friendly process for counties to be able to communicate with us in a satisfactory way while making sure we protect the HIPAA requirements?
So let me make sure that I understand your question. It sounded to me like you were asking whether or not Cal Ojai engages in doing some oversight of the relationship between state entities and county entities in that sort of exchange of information.
Yes.
And the response to that would be yes. So the way that Cal Ojai engages in that oversight is to ensure that state departments are effectively overseeing that relationship and managing any risks associated with the sharing of that information. There are tools such as contracts that are called business associate agreements, and we do look to see whether those are appropriate, whether they have all of the requirements, whether or not they're being the oversight is there by the State Department of their business associates and how those entities are using, sharing, and accessing the information. So that's always been in place, and that will continue to be in place.
And just lastly, one last question. Do you have reporting requirements to the federal government to ensure our compliance with the federal act, or is it on their dime, if you will, to check you out in case they feel that there's any insufficiencies?
So let me make sure that I understand. It sounded to me like, let me see if I can answer that. So state departments are not, Cal Ojai is not required to report to the federal government deficiencies in state departments. We, of course, liaison with the federal government in the event that they would do a real thorough audit of any state department. And we would, of course, facilitate, coordinate, and liaison, and essentially act as an advocate for a state department in that kind of context. State departments, of course, have some mandatory reporting requirements based on federal law, but that's consistent with the types of reports that we would get. Okay. So if the federal government hears about it, we're going to hear about it too. We need to be on our toes for these things.
Thank you. Good luck on your continued good work.
Thank you.
Thank you. Finance, LAO, any comment on this issue? Any public comment on issue number 1? Thank you very much.
Thank you very much. Have a great day.
You too. Moving on to Office of Patient Advocate. Issue number 1, Complaint Data Reporting Project. Here we are again. It's good to see you. Welcome, Ms. Abbott.
Good morning, senators and staff, members of the public. My name is Beth Abbott. I'm the director of the Office of the Patient Advocate. And believe it or not, I'm really glad to be here. I was hoping I was going to beat you to the punch, but I didn't quite do that. I wanted to tell you, since you asked about the status of the complaint data report, actually, I am so sorry that it is not done. I think I might want it done sooner and better than you all, if that's possible.
Well, that's good news.
It is.
That means you're working on it. I appreciate that.
I am working on it. Yes, ma'am. The statute said that it was supposed to be on our website July 1st, 2015. We have not done that, but we have been working like crazy. OPA has 6 staff, which is, and we've got everyone deployed on this because it is such an important and critical effort. It has been a lengthy delay, and I am apologetic about that. It has been principally due to the complexity of the data and the fact that we've really tried to do it in a collaborative way with the 4 reporting entities. I'm trying to work through all the issues with them for this background report so that this will go better in future years. And
in referencing future years, I think sometimes through legislation, the legislature requests a report, appropriately so, and then we set a time frame. And I'm not sure how arbitrary it is sometimes when we set the time frame. So based on your experience this go round, what do you think is a reasonable time frame for us to expect future reports?
well, they are due July of every year. I would hate to sign away all of my children that the 2015 report will be up on July 15th, but we are working on that simultaneously. If I were to tell you the absolute God's truth, I would say it would be a little late, but not this late.
Okay, all right, fair enough. I appreciate your honesty.
I would say, if this is any consolation, it is a reflection of how important we think this report is that it is late. I could have tossed something off a long time ago. And because it is a baseline report, sort of the snapshot of where we were in 2014, and there is no precedent for this. This is not like we can copy the Missouri report or the New York report or the Alabama report. Nobody does this. So the people who envisioned this report and what it should contain which is the people in this room and your colleagues, it was a very thoughtful and comprehensive piece of legislation, and it's very good. I'm proud to be associated with it. I'm also a consumer representative to the National Association of Insurance Commissioners. That is sort of to my detriment, but anyway, that's another story. But other states are really interested in this, and they see this as landmark legislation. They don't know what it's going to look like, just like you don't know yet, but they are very, very interested in it. I want to mention to you some of the problems. There are not recognized complaint categories that we can copy nationally or from another state. So we had to develop them. California is a unique marketplace, as you know. We have way more managed care than any other state. We also have a state-based exchange, which is actually fairly unique. So when anything resembling established coding does not exist. So we had to develop that in collaboration with the 4 reporting agencies, which are the Department of Insurance, Department of Managed Healthcare, Covered California, and Medi-Cal. And you might already be aware those are pretty different business models. There is nobody that has anything resembling this. So we developed a lot. We started with the National Association of Insurance coding categories, but the NAIC is an insurance organization, so it does not correspond exactly. And so we had to develop categories in collaboration with the reporting entities to make this report cover all the stuff that it was supposed to. I think we're really close to having the report ready. We are going through the last part of the validation of data. We ask questions. When we get information from these reporting entities, when it doesn't look like it comports with the other agencies, we ask questions of everybody. What did you mean by this? How did you count this? Why does this show something so different? So we had the last resolution of that and substitute data submitted January 28th, 2016. I really had my heart set on getting this to you on time, and I'm sorry.
You have a guess, but now about when you think it will be done? You know, we have a rule here in sub-3
Yes, ma'am.
called the seasons.
I say spring, ma'am.
Spring 20.
26, oh, you're cute.
Yes. Just like clarification. Spring 2016. Fair enough. I'm not going to hold you to a month, but spring.
Yes, ma'am.
Spring work for you, Senator Stone? Spring, all right.
So we are validating this, and we are really close. Where it's going to have pictures, graphs, data, all sorts of, it's going to be razzle-dazzle. I will give you a preview of coming attractions, just so you know I'm just not diddling around with this. And of course, nobody knew how many complaints were going to surface. I actually did a lottery around the country when I would give speaking engagements and stuff. I said, how many complaints do you, this is our newest thing, what do you think we're going to get? And some people guessed 50. I said, are you aware of the population of California? But I'm going to give you a preview. I'm sorry Mr. Monning isn't here, but you whisper this in his ear. The number of complaints is 27,028 complaints, and we're also supposed to track inquiries, and that is 5,920,845,000. So we have a lot. This is a lot of data to look at. Nobody knew any of these codes. Nobody knew how to tabulate them. We collected demographic information, a number of things that we had to put together and try and make comparable. I did briefings, as it turned out, a little prematurely, and I'm sorry about that too, with legislative staff, with Senator Monning's office, with consumer advocacy organizations, with industry. And we're going to do press outreach on this. It's going to have confetti and dancing girls. We are so excited about doing this. And I think it's going to be soon. I really do. In terms of what we think we're going to do in the second year, so I'm already planning ahead. I'm not going to be a laggard. But we have thrashed through so many implementation questions and categorization and how do we count this and where do we put that, that I think it will go much more smoothly in 2015. People have a full year of data. Sometimes all of these reporting entities had to scramble, not that this was a secret anonymous piece of legislation, but when it was implemented, they had to get all this stuff ready. And in some cases, they had not been tracking this information for the full year. They had to get implementing legislation for them to capture this data. They had to train their staff. They had to do a bunch of stuff to get ready for this. So they have 1 year's familiarity of going over this, answering 1,000,002 questions from us. And they have assigned this to regular parts of their organization to make it part of their ongoing workload, which gives me hope that boy, your lips to God's ears. I hope so. I think that might be overstating a little bit, but I would really like to have it be very regularized and part of their components workload. And they have completed a bunch of training and reorientation. They are sick of our questions. One of the big things, this may sound very mechanical and not of much import, but it actually is pretty important. We have gotten our systems contractor to do an input validation scheme where somebody inputs, let's say, a complaint with data that is in a 4-digit date, and that's not what we're using. We're using the much more Y2K compliant sort of date format. And so what would happen this year is we had to call them up and say, hey, you guys, you've got to change this. Now we have got built into this, and this was a production to get this done, but they will get a bounce back message that says, we didn't take your data because it is not in the right format, so straighten up. And so that alone will make it simpler. So I think that we've had a lot of first-year growing pains. I'm really anxious to get this out, and I'm going to be so pleased to do so, and I will bring the champagne if we can do this just as quickly as I hope we can, and I'm ready to answer any questions you have.
Appreciate that. Senator Stone?
No, we certainly understand the complexities and the establishment of codes and protocols. And 27,000 complaints, you know, with the implementation of Covered California and our Medi-Cal system, to me, it's not bad,
No,
you know.
I agree.
But I'd also like to know, without you revealing, of course, all the details of the report, can you just tell us what some of the top complaints that you've seen so far, just to kind of give us a heads up of what we can expect to see?
Yes, we have a lot of complaints on access to care, non-payment of care, for care that was rendered, insufficient payment. One of the things that I'm actually very disappointed as an outcome, and I will admit to this now, we as a state do not do a very good job of soliciting complaints from non-English speaking people. And I'm pretty sure we have a lot of folks who have had difficulty getting the kind of perfect service that they are entitled to and are interested in getting, and it's a life and death matter in many situations, and we're not doing a good job. So I think we all need to concentrate on that. Part of it is probably tracking the first year and that kind of stuff, but it is, I think for a multicultural state like California, that is a real deficiency. And so I would think that would be something that is talking about the universe of complaints and not so much whatever. I think the kind of complaints that we're getting are ones that you could anticipate just as well as us.
But you don't need any legislation to direct you to have better communications with non-English speaking citizens. That's something you can do in-house, I presume?
Well, I mean, it's something that we actually answer the phone still, because but the legislature has changed our mission from a consumer advocacy organization, regardless of our name, but our colleagues like the Department of Managed Healthcare and Department of Insurance and Covered California all are doing that, and I think they are very well aware that that is their responsibility, and they are attuned to that.
Okay.
I don't think we need legislation to fix that. I think we all know that intuitively, so that's my view.
Seems logically that we should be pursuing that path. Thank you.
Thank you. Finance, Leo, any comment? Any public comment? See none. Appreciate you, Ms. Abbott. Thank you. Spring 2016. I'll be waiting for it.
Yes, ma'am.
Thank you.